And IVF is great, and we all, as practitioners, love doing IVF because it's the most successful per cycle thing that we do. However, it's disturbing to a lot of us that there's been a huge push for patients who really don't need IVF to do IVF. And I think part of that is because there's been a sort of corporatization of fertility clinics throughout the United States now. And unfortunately, IVF makes the most money usually for clinics. So you'll review records from other places that say, we discussed with the patient that IVF is the best way to achieve pregnancy. And I'll look down through that and I'll say, well, this patient just needs to ovulate. They don't maybe need to do IVF. So that's, kind of disturbing. I think it's important for patients to really have the agency to ask a lot of questions and say, do I really need to do this? Because IVF is not just expensive and invasive, along with being effective, but also there are downsides to IVF. If you create more embryos for a family than they're going to probably want to use, that's kind of a bad thing. So to take a 20-some-year-old woman with polycystic ovary syndrome and run right into IVF and create a bunch of relatively low-quality embryos, which a lot of the time, if the patients with polycystic ovary syndrome are not treated well ahead of time, we're going to find. But even if they have good quality embryos and they have, say, 10 or 12 of them and they just wanted to have 2 children, that's an issue down the road for a lot of those families. That can be a big ethical problem. So I think it's important for patients to try to figure out, hey, what is going to be the best course for me?